reality is that the great majority of patients with chronic rhinosinusitis are going to be treated medically. And at the moment, there are enormous shortcomings in the efficacy of our medical treatments. For example, topical corticosteroids, effective drugs, but they can only improve the patient's rhinitic symptoms because their ability to access healthy sinuses is virtually zero, diseased sinuses absolutely zero. So our best and our safest drug has limited efficacy. Prednisone, our most efficacious drug, enormous long-term toxicity, so can only be used for a matter of a few weeks, a few times a year at most. And then we have antibiotics. And I think the reality is that if you look critically at the literature demonstrating the efficacy of antibiotics, it boils down to very, very little. And so we have a number of patients who fail or become resigned to being a bit miserable because their family doctor or indeed their ENT surgeon has done their best for them, but they haven't got better. The next step really is surgery. And that's a massive step. It's a massive step in what can be provided by our healthcare systems, by expense, by availability of surgeons who can perform endoscopic sinus surgery, given how many patients there are of chronic rhinosinusitis. So I think there's this gulf which needs to be filled of an absolute imperative to develop more effective medical therapies.
The shortcomings in the care pathways of patients with chronic rhinosinusitis are mainly linked to the fact that 35% of the patients still remain uncontrolled despite maximal medical treatment and also surgical treatment. And therefore, we need to join forces to improve the outcomes of both medical as well as surgical treatment. And improving outcomes means the implementation of precision medicine in the care of patients with chronic rhinosinusitis. There are multiple trials ongoing on novel treatments for chronic rhinosinusitis patients, both with as well as without nasal polyps. And in those patients, we need to invest a significant amount of time and energy into finding novel and better treatment options. But we should also not neglect the fact that current treatments might be more effective if we apply them correctly and timely.